Care to chat? Hello and welcome to the Northern Ireland Social Care Council's popular podcast, Care to Chat. I'm Wendy Austin and it's my great pleasure to host these podcasts. Real privilege to hear the stories of social care practitioners and social workers and their clients, and to hear too about the many different and important aspects of the work itself. There's a huge range of situations in which they come into play, from domiciliary care to complex areas like criminal justice, from early years to end of life. So this time something a bit different. Your work as a social care practitioner or a social worker, how do you evaluate it? How do you measure it, benchmark it? Where's the evidence to show its effectiveness? Well, for all of that you need the research. But is that not something for academics? Why is research such a priority for the Social Care Council that they hold a conference on it each year? Well, let's find out. We've four of the best here in the studio to bring us up to date with this. McGlade, who's Social Care Research Lead with the Social Care Council. Professor Paula McFadden, Professor of Social Work at Ulster University. Flannagan, Senior Social Work Practitioner with the South Eastern Health and Social Care Trust. And Lisa Morrison from Lisa Morrison Consultancy. Thanks all of you for coming along today. And first of all, why is research a priority for the Social Care Council?
Well, within the Social Care Council, I think we believe that people who lead and develop services really need to be supported and encouraged to use evidence to inform those services and inform the design of services. Our role is very much about public protection, safe practices, and it's important for the public and people who use our services to know that the services that they are receiving are actually informed by good, sound, robust evidence. So really, it's how it fits into our functions about safeguarding and continuous professional development.
It's something that people sometimes need a bit of convincing of, Paula, isn't it? And I used to be involved in a charity and the chief executive kept saying, we need the evidence that what we are doing actually works. And there was quite a bit of head scratching around the table because we just all thought that it did, which is probably a bit arrogant. But is there still a bit of pushback there?
So what you'll find is that people with tacit knowledge and practice, which is extremely valuable and built up over many years and experiences, value that and see that as the primary source of knowledge. So beyond those anecdotal kind of practice, knowledge and wisdom, it is really good for social workers to begin to think about how the evidence beyond the anecdotal. So what we have been supporting social workers to do is to get involved in research from undergraduate training stages onwards, where they would be citing literature on research and have the evidence, whatever interventions they're referring to or what theory base that they're drawn from. And then beyond the initial training and to post-qualifying training, we encourage people to strive towards doing research methods training so as that they know then the systematic way to go about gathering evidence in relation to practice, to inform their practice and build public confidence in what it is that they're doing.
Now, Maria, you've gone down the research route. I mean, you're a senior social work practitioner. Was that a natural progression for you from what Paula's been talking about, the kind of undergraduate research that you have to do when you're doing a degree, and then moving on to that continuous development that there is as a social worker? Was it a natural progression, or did you have to take a bit of a journey to the right or left?
A leap of faith. Well, I was very privileged to start a new role in the multidisciplinary teams that had been rolled out. And that was a massive reform for healthcare. So for me and for my own professional integrity, I was wanting to produce this evidence-based outcomes for the individuals and the communities that I was working with. I can resonate with what Paul is saying about, the tacit knowledge. And we did, the experience that I had over my social work career, you do build that up and you do feel confident in your practice. But with this role, it requires the innovation. It requires the development of new thinking ideas. And for me, the research and looking at the unidentified need within the population that I was serving, I sort of wanted to make sure that I was serving them, adequately, appropriately. And any strategic driver that has come out, it's very focused on our evidence-based practice. So again, for my own professional curiosity, and looking to make sure that I was delivering for the people that I was working with, the research methods really helped, and it made me more confident in my practice, and made me more confident in the strategic decisions that I was making. And it also, I've got a promotion. So I'm the social work lead now for the Down on an interim basis. And I believe it's from that research and from that strategic thinking and from that looking at that service improvement and service development that Anne was talking about, that gives you that skills and that confidence as a practitioner to push yourself on.
Now, Lisa, you're looking at all of this from a very different, from a very different perspective, but actually from a number of different perspectives, as we'll find out. I mean, on the one hand, you are a service user, but you also now are training social workers as well. So tell us a bit about your story being involved in social work and social care research.
Well, yes, I've used services for a very long time. And I think this opportunity came about via my network, really, from somebody else who was a carer of somebody in the system. And I think it's a real strength of the course that they have places for people who have used services as well, because that's such an important voice and experience to bring to the mix. Maria and I were on the course together, which was lovely, and just to be learning from each other. I think for myself, it's been transformative actually doing this course. It's provided me with knowledge and skills that have really helped me I consider myself an activist. I advocate for people's rights in services. And what I was finding in the work I was doing, even work, sitting on the all-party group for suicide prevention, for example, sometimes academia or academics can be used. You can feel a little out of your depth with that. And it can be difficult then to speak up really about issues when you don't really know. I didn't know what was good evidence, what wasn't. So for me, and the way the course was structured is so powerful, because the first year you're looking at doing a systematic literature review, which teaches you about what is good quality evidence, so you're developing those skills. I didn't want to go, I'm 51, I didn't want to go and just study something for the sake of studying. I wanted to be able to learn in a way that I could apply to what I'm doing, to make changes, to advocate for what I believe in. And the way the course is structured, you do research in the second year, so you can practically apply to something that you really care about. And I think that's a strength, not just for me as a person who uses services, but I think for social workers as well. We're at a time where stress, burnout, all those kind of things are so high, and very often something like this can be seen as an add-on. Whereas, in fact, it's an opportunity for people to take things that they really care about in the area where they've built up that knowledge and experience, that tacit knowledge you've been talking about, and use the research and the evidence to actually do a piece around and say, well, this is how it actually is. Because what I found in my research is it backed up a lot of what I was doing, but I also found out things that I didn't know.
And Lisa's been talking about the course that she and Maria were both on simultaneously. Tell us about that course and where it's run, how it's accessed, all of that.
Okay. Well, the particular course that they are talking about is a post-qualifying research methods programme that has been run for many years as part of really the post-qualifying framework and professional and practice framework. But what we really like about research methods training is that exactly what Maria and Lisa are talking about, it actually moves beyond the academic ideas of research and breaks it down into more simple language. We want our social workers to be curious about their practice, and we believe that if you didn't even use the word research and you just started off by saying, what's happening in your practice? Ask a few more questions. Why is it the service running like this? Why are we doing this? How could we actually prove if it's actually working? Now, obviously that's research. But we all know that the word research can be quite daunting for social workers and indeed managers and, should I say, possibly policymakers as well. We really want to get the message across that research is interesting, research is exciting, but research is absolutely crucial for improving services and ensuring that we're delivering outcomes for people who use our services. So this course has been running at Ulster University for a number of years. There are other courses available as well, but we did change the course in the middle of 2015 to really fit in with the first research strategy and the requirements of the research strategy back in 2015, and the course is running from that time. And I think the excitement that you hear from Lisa and Maria and in their engagement with it shows the value of research methods training.
That's good to hear. But Paula, what kind of research do people do? And, we hear, as both Lisa said and Anne has said too, social workers are up to their ears, aren't they? They have enormous caseloads, a lot of stress, and we've heard in other podcasts about the various kind of mitigating factors that you can put into play to help deal with all of that. So why would you want to do research on top of everything else?
Yeah. So social workers are interested in research primarily to improve their practice and to improve the service that they're delivering for people in need, at points of crisis in their life. In order to maybe attract more social workers to want to do research, I think we have to demystify the terminology. People might think that research is all about numbers and formulas and not really realise that research is far more accessible than most people think. It is a systematic way of approaching a question, a bugbear, trying to find out systematically what is going on, taking a deeper dive into a specific issue. So, for example, some of the research that people will do, I'll give you some of the examples from our current research method students. One is looking at, what are the wellbeing interventions that social workers prefer? What do they use? What can, really support them to stay well and continue in the profession? Another interesting one is looking at, how come social work is such a female-dominated profession, and looking at that through the lens of a male perspective. Those types of research are using qualitative methods, which means that it's really about interviews and focus groups. The data that comes out of those, and these big words like data can put people off, but it's literally the recording of words, phrases, things that people are saying, and then the systematic examination of what the themes are that emerge from that. So you can come up with, any kind of question or bugbear and systematically approach how you're going to get the answer from that. They then go on to publish not only in a report format what the findings are, and those publications can have local, national and international implications. They can go on to get published in peer-reviewed journals. All of that is supported by both employers and tutors, from an academic perspective. So people coming to do like a research methods course, they have a really strong infrastructure support around them to do it. We work really hard to demystify the language and make sure it's attractive and accessible. But we're wanting to do that more. I think at the moment we have a PhD research network for social workers, and I think there's 32 members of that. Go back a decade or two and you would have been counting on one hand the many social workers that had PhDs. So the Masters kind of sometimes hooks people in. They want to go on and do the next level. It's kind of addictive when you do research and you understand you can bring answers to the table, expand knowledge. You want to do it too. So I'm hoping that's what we're growing in the culture of research from all the perspectives that I'm listening to around the table.
Have you got the bug, Maria? Are you hooked?
Do you know what? I really am. I've joined my Trust research group to try and promote research within the social work profession. And I can attest, it was that peer. My colleague before, who I worked alongside, they had completed the research, and when I seen how doable it was and the excitement it caused, and even from my own experience of doing the research, getting round to speak and doing those interviews, it's invigorating, and you really step back and you're able to appreciate everything that your colleagues are doing, and I think being able to voice that as much as you can on their behalf, just to show and, as Paula says, disseminate your work, it's very powerful. And I think there's a lot of work as social workers we do that goes so unrecognised. And I just felt like the research methods for me helped just really highlight that, the depths that people are going under to help serve the communities they work in, the individuals that they work in. So you do get the bug when you get started, and I definitely have people tortured and continually bang that drum about doing it and how doable it was. And I was very lucky I done it with a colleague, so that was peer support, and then with our own wee team at the time, it was 4 of us. It was brilliant, and it got us through.
Yeah,
it's what got us through, and making these connections now is just so important.
And you wanted to come in there, I think.
Well, it's probably slightly on a different track, because I think we want to think about it strategically as well. The Research Methods Programme, we know that the people who join it are so enthusiastic, and they are our future for research. But I suppose what we need to be really driving is the whole leadership of the research agenda, and that's why the Social Care Council is playing a really key role in that position at the minute, taking a lead back in 2023 to really put into their strategic plan and their business plan that research, evidence, data, and intelligence is absolutely crucial for safeguarding safe practices, continual professional development. And we've been doing lots of work within the Social Care Council to support that wider agenda so that we will in the future continue to have research methods training available for our social workers and people who use our services who can get those opportunities.
Paula was saying at the very start that often the lived experience of people who are doing the job and the kind of anecdotal, this is how it works and this is what's most effective and so on. I'm guessing that sometimes whenever the research is applied, that actually it shows that sometimes that is actually the case, that that what you thought was working is working. But I suppose what I'm getting round to is if it's gone through that rigorous research procedure and it's then published and has that academic background, if you like, does that give it more clout? Does that make something which was maybe blindingly obvious before, but does it give it that kind of actually, yes, this really does work?
Absolutely. When you're fit to argue beyond just your views and opinions, when you can actually look at the evidence, you've got local evidence, possibly national evidence, international evidence of what's actually working, and indeed what's not working, I think is the other challenge, because research will tell us what isn't working as well. And it's really being able, at policy level, at practice level, and at management level, all those levels, it's not just our practitioners on the ground, which is why I think the leadership for research is so crucial, that they are thinking about the needs for research and evidence in any work that they are actually doing.
I'm going to bring Paula in 2 ticks, but Lisa, you were nodding furiously when Anne was talking there about the heft that comes in behind something like the research, about both things that do work and things that don't.
Yeah, I think it's very much that this course has equipped me with, certainly, is bringing the evidence behind if you really care about something and are wanting to put forward, a case. And at policy level, I mean, part of my research, I've had conversations with the Department of Health. It gives you that confidence and the foundation to actually be able to argue for, what you're saying. But I think also what Anne was saying about leadership, certainly as somebody coming on the course who doesn't work in a trust or an organisation, there are other layers of complexity to being involved in the research. But it's so valuable to have people like myself in, and I really, credit the course and the leadership around involving people, in this. But then the structures need in place around that, not just for staff, but for people to be involved. And I think I'm doing a process evaluation with the trust and my practice assessor that I worked with. And certainly the work that I have done, which was with social workers specifically, is it took the practice assessor to actually buy into and support my topic, what I was interested in. It was also of interest to the trust. Then there was the approved social worker leadership team who said, we want our service to be the best service that we can have. We are willing and open and have the courage to learn the good and maybe the not so good. How can we facilitate your involvement in this? And then my tutor, Anne was my tutor. I had that academic support in order to actually do the work well. So it actually took a whole team and buy-in to it. And what's come out of it actually is what we talk about quality improvement, is from the findings of my research, the team have then implemented some changes. But it took a whole system, in fact, to support and buy into the research. So I think at many levels, and I also think social work and social care can be seen as a less than profession. It's not the bright, shiny, medical. We've got all the things going on with that. But in fact, if you look at the international evidence, what social workers do, human rights-based, community-focused support and interventions is really the core of what keeps our society running. And I think this research and leadership in it should be elevating and, in fact, putting not just the people working in the services who also use services, but all of us saying this matters actually a lot.
Paula, very well put, Lisa, if I might say so too. I hope you held on to your train of thought there.
Yes, I did. It's like this is like an organic conversation that's all come together really well. And I was thinking about the impact of research, right? And in the universities, we talk about impact in terms of we have a research excellence framework that we have to answer to about every 6 or 7 years. It's UK-wide, and funding is dependent on how well each university performs in terms of their impact. So it's a slow build, right? But what I find with the research methods programme and the course and the candidates coming through is that the impact is direct. It's not a slow burn, it's immediate, because the ideas around the research questions have evolved from your practice. You are really energised by it. The employer has to buy into it and approve it, that it is a priority for them. So you're seeing an immediate change. So over the years, we've seen, like Lisa, you've described, an immediate change to some of the practice and policy directly informed by the research that's produced. And we have multiple examples of that happening as well. So it's really, what would you say, heartening to see the research having such a direct impact on practice and policy, and they know that social workers are getting so much so directly in a timely way, as are the service users from that process.
So being curious and thinking of doing something that can make a difference, this is maybe the way to go about it. As you say, there's a sort of immediate impact.
Yes, it's the fast way of going about creating change that's evolving from some bugbear, some issue that you've identified in practice. It's very much as accessible. It isn't always. Research can be about numbers, absolutely, and the scale of that can tell us great things. But in social science, a lot of our very valuable research is all about the diving in deeper, the qualitative, the voice of the people that you're interviewing, that systematic gathering of evidence and knowledge that can then be shared elsewhere. So it's not always about numbers, and I suppose that's part of our mission, is to demystify the terminology of research and maybe take away some of the fear, that people might have around getting involved.
I wonder to what extent that fear extends to social care practitioners, Anne, because we've really been talking about social work here up to now. And would I be right, or would I be prejudiced in thinking that there's more likely to be research done in social work than there is in social care?
No, I don't think you're being prejudiced. I think that is more of a reality, that the social care research world, not just locally here in Northern Ireland, but nationally, and probably, I hasten to say, probably internationally, is a lot less research available. For a whole lots of reasons. I think it's the complexity of social care and what it actually entails, and how staff are trained, and at what level are they recognised. And that is where I think here in Northern Ireland that will change. It'll be incremental, and we'll bring it back to our own organisation when we talk about the professional in practice framework. That is the post-qualifying framework for social workers. Work is being done on the care and practice framework for social care. That is also, and that framework is actually about, well, what levels of training do people need? And it's one thing talking about the level of training that people need, but those opportunities for training then need to be available. And certainly research will be a core element of that as well. But I think, back to your question, I think there's less research available, but it's increasing. It's increasing.
I mean, it must make a bit of a difference, Paula, that social workers have already done a degree and have a familiarity with the kind of research that we're talking about today. Whereas if you're a social care practitioner, the chances are that maybe that you haven't. Now, that's not always going to be the case. And one of the social care practitioners that we hear from in a different podcast had a degree in ophthalmology from India and a master's degree as well, and had got her level 2 diploma in social care. So let's say that there's a fair chance that Rishi will be going on to do some kind of research in the future. But as far as social care practitioners are concerned, where do you start to try to get them hooked? Do you start with the leadership? Do you start with some of the new entrants who are maybe doing the new courses that are required for them? It's a massive workforce.
It's a massive workforce. You're absolutely right. Social care research that I've been involved in would have been during the pandemic, where we would have been looking at well-being and burnout in social care workers as well as social workers, and we're able to divide them out between those in care homes, those in hospitals, those in domiciliary care. And so there's been some research, as Anne's saying, it'll be a growing sector, but there's research, done from that perspective. For me, it's important that social care workers themselves are part of that voice, not only in how they respond to like surveys and focus groups and so forth, but also to be involved in an advisory capacity, and we would have included social care workers and managers in an advisory capacity during that piece of research, because it's really important that we elevate voices that are otherwise not really heard, and because social care workers is such a practical kind of a role and job, and because the training didn't involve a degree, there is, less of an assumption that they might want to be involved in research and so forth. But in my experience, they've loved being involved and telling stories, and some not good and some beautiful stories that can come out of social care work. So we do definitely have to grow that evidence base around social care.
They're the ones who know, aren't they? The
Exactly.
social care practitioners. They're the ones who have the closest relationship with with their clients, with the people that they're dealing with, and they also often, it would seem, just anecdotally, from my point of view, from those I've spoken to, they do feel that they're not heard, don't they? You're nodding there, Lisa.
Yeah, I just think this whole conversation, and I think there is the bigger picture. This is a slow burn, as you were saying. But I think the fact that it's on the agenda, that it's part of why a new strategy, renewing the research strategy is so important, because it's not going to change overnight. But it is something that is part of the future and has to be part of the future, because it's just what you're saying. Those of us who've walked the walk, there's knowledge and wisdom and experience there that needs to be heard. But apart from that, if you think about social work being a rights-based profession, so often people most impacted by poverty, discrimination, violence, all those kind of things that impact our health and well-being, whether that be mental or physical, those are the very people who don't have as many opportunities to education. And although because of financial constraints, on a very practical level, and then even sometimes perception of what I'm able to do. And yet there will be people who need those opportunities, and part of a way forward should be paving the way for more people to be able to be involved and the barriers to that being removed. And that is a government, that is from a top-down level in terms of prioritising and saying this matters, this work matters, these people matter, and our voices matter.
Anne?
Yeah, I think you were asking about I think you were asking Paula, where do we start? And obviously, it's horses for courses. You can't land people in doing a master's course at a very high level if they are actually working at a different level. And that's fine, because incrementally we need to build those skills. But I think we can also do that by managers of care workers. They're really important, as are managers in the social work world. When they actually got the appetite and the enthusiasm for research, you could actually see the connection about how they were encouraging their staff. And I think it's going to be the same thing. You need to get people in at different levels and offering opportunities at different levels, whether it's on advisory or whether it's actually on training. And they're going to be the things that we are going to be thinking about as we develop the strategy that Lisa just referenced. We have had a social work and social care research strategy in place for many years. In fact, we'll be into our third strategy. But on that particular developmental work, we in the Social Care Council have been engaging with a vast number of people, including people from social care, people from the clinical world as well as our social work worlds. And our research and evidence partnership that we established in 2023 will be about going forward into the future for social work and social care research. What are our priorities? What do we need to be putting in place to support, and what sort of resources do we actually need to do research?
Well, looking at the future, as you mentioned there, just for all of you, I suppose, Maria, what would be your hopes around research in this area for the future? I mean, what are you intending to do, actually? I'm kind of wondering.
What am I intended to do? Well, I do feel that it's very empowering when you do a piece of research and something that you're passionate in within your workforce. And, sort of listening about with our social care colleagues too, I mean, I think it rejuvenates you, like I've spoken about before, and it gives purpose to why you're doing this in a certain way, or else bringing that their different viewpoint in by getting that evidence-based. As I say, I am now with my trust's social research group, and we're very much looking at how we can promote, and as you're saying, looking at our managers, looking at our leaders, looking at what are the barriers to social workers coming forward and wanting to complete this course. And I mean, we all know the workforce pressures, but what I feel that we can lend our voices to is that we've done it, and this is how you can with the support. And I suppose from my trust's point of view, this is what we're trying to push and focus on. And again, I just love research. I just think it vindicates what we're doing, and it gives you that. When I'm speaking to anybody, or if there's something in that direction that something's going in, I can stand over that direction now. I feel confident enough to do that. Whereas before that, yes, I had confidence in my practice, but this is just sort of rubber stamped it to say this is maybe the best avenue to go down. So, I mean, continue learning, and that's what I'll be taking out of this, and promotion of the course most definitely.
You'd be glad to hear that, Paula.
Absolutely. Bring them on.
And what about your hopes for the future?
So continuously, I think, just to support the workforce through training and research methods. They provide opportunities, to disseminate and help disseminate the work that our social workers are doing in terms of research. But I just, think that I'm heartened by the number of PhD social workers that there are at the moment, because that really, I've said it before, that's new. That's a growing, thing that social workers are starting to embrace and see the role modelling from others by getting involved in research and then going on and taking it to the next level. So I would just love to see that growth continue. My own research is about workforce wellbeing and burnout on a larger scale. I'm turning attention to the impact of that on service recipients, on service users, whenever there's gaps and turnover in the social work workforce, and how that's impacting. Also what it's costing, because there's a lot of public funding wasted on turnover in the sector as well. So it's always trying to target, areas that we know little about, and we need to know more about, and support others to do the same.
Lisa, what about you? It's been quite the experience for you, I think, hasn't it? And I'm guessing for others who were involved, like Maria and Anne at the same time, hearing your perspective must have been enormously helpful. How would you like to see the research area changing in the future?
Well, I'm involved in the Research and Evidence Partnership, which is one way I feel I can contribute from what I've been given, the opportunities that I've been given. I think my hope is really around how research can actually break down barriers and bring people together. Those of us who use services with people working in services, that it can actually almost be a bridge to connecting people in a different way. And I think this course certainly offers opportunities for that. And also just thinking about how, what I've said before, social work and social care should be elevated and take its place rightfully, that people need to step into and own just the importance of what they're doing, because this is, if you get down to it, it's about, for me certainly at a time when I had no rights, I had no voice, and I needed a service and a workforce who were able to know and support me in a way that could, and that wasn't always the case. Sometimes it was. And I think there's been transformation on an individual level. I mean, being involved in this process, working with the trust, with people working in services on a very personal level has been healing for me, because of the power inequalities were actually not there because of the values that were brought in that work. And so that's been part of a personal journey for me. And then on a wider level, being able to, as you say, Maria, take that evidence to actually advocate for things that I really care about in a way that I feel really confident and able to do that. So, yeah, my hope is that this will continue even in times when resources are scarce. You know, that this is something that is seen as a priority that needs invested in and actually really matters. And we do what we can with where we are, with what we have at any one time. But this very much needs to stay on the table, because this is about saying our workforce matters and the people that they serve matter.
You wouldn't disagree with that, Anne?
Oh, absolutely not. I think everybody's probably said all the things for our hopes for the future. I suppose we've been building the foundations for the research and evidence agenda for many, many years. And my hope and ambition is that we go forward and we go from strength to strength. And our research and evidence partnership, which we've established, that Lisa referred to, our research community that we've got established, which is a vibrant community, and our PhD networks, that they're all the ambassadors for the future, that we will be still in talking with the same excitement as we are now in 2025 in many, many years to come, so that our profession benefits and the people who use our services benefits through the use of research and evidence.
Look, thanks all of you very much indeed for joining me for this episode of Care to Chat. Thanks to Anne, to Paula, to Lisa and Maria. If you want to find out more about research, why it's a priority for the Social Care Council, or indeed about the research methods course that we've been talking about as well, if you go onto the NISCC website, our research, it's all there, and you'll find out lots of other information as well, all of which is very useful. And conveniently, it'll also link you into all of the Care to Chat podcasts. You can catch up with previous episodes. Sign up for the future, subscribe, it doesn't cost you anything, and then you won't miss any more episodes. Do, of course, also tell all your friends and colleagues, and thank you very much for listening.